like I mentioned before, I'm a general dentist with a family practice. The range of services, traditional fillings. In my office, I only do white fillings. Most dentists today really only do white fillings. A few still do the silver fillings, but patients have pretty much demanded that it's white fillings at this point, and we have the technology to do white fillings that last a long, long time and look great. So that's a service that I offer. As far as restorative dentistry goes, I do everything from full dentures to partial dentures to fixed restorative work, which would fall under the category of crowns and bridges for restorative purposes and for cosmetic purposes. All these are the traditional functions you find with a general dentist. I also extract teeth, everything from wisdom teeth to painfully abscessed teeth. A lot of patients come to me for the first time in pain, and that's a big part of a dentist's job, is to be able to relieve that pain in a way that is as painless as possible, that is humane as possible, and as quickly and efficiently as possible. So all that goes into what I do. If a patient is a severely abscessed tooth and it needs to be extracted, it's my job to get that patient numb and get that tooth out as quickly as possible. I know there's a few dentists around here. I hear it a lot from patients actually that have been to other general dentists that don't extract teeth. I honestly don't understand that philosophy. We went to dental school to learn how to extract teeth, and it's one of the primary objectives of our job is to relieve patient suffering. A lot of times the only way you can relieve a patient's suffering is to extract a tooth that is not restorable anymore. So I feel like we have to be able to do that. There are tiny 1% of the cases that I have to refer to an oral surgeon that are just beyond what any general dentist I believe should be attempting. But in the vast majority of the cases, 99% of the time, I would estimate, I can extract that tooth for the patient in a way that is humane and immediately gets them out of pain. Another procedure that patients fear a lot is the root canal. This is a procedure that relieves pain while allowing a patient to keep the tooth, and eventually that tooth usually will need to be restored with a crown. Once again, we have the technology today and the training and the science behind us to do these procedures quickly and painlessly. I do a lot of root canals in my office, and allows a lot of my patients to keep their teeth for many, many years without any pain and complete function and beautiful aesthetics afterwards when we get the tooth restored with a crown or a filling, whatever it needs to be restored with, by doing a root canal and really helping them maintain their level of dental health and function